Radiotherapy plays a key role in the local control of neoplasms. The possibility of obtaining high rates of control in many tumors depends on the increase in radiation doses. Often, however, the tolerance of normal tissues is a factor that limits this possibility. Intraoperative radiotherapy is a procedure that allows the administration of a single high dose of radiation on a directly exposed tumor target during surgery. It is a selective technique that allows the accurate and precise identification of the target volume to irradiate, so that the surrounding normal tissues, which are usually mobilized away from the radiation beam or appropriately shielded, are spared from irradiation. This method makes it possible to administer a higher radiation dose, thus increasing local control while keeping toxicity at very low levels. The target volume may include the surgical bed on the areas believed to be more at risk of recurrence after complete resection of the tumor, or the residual tumor, which cannot be technically excised, or even an unresectable tumor to control or delay its symptoms. ELIOT requires good coordination among the surgeon, the radiotherapist, and the physicist, who are supposed to agree on the optimal approach for identifying the area to irradiate and the best mobilization of the surrounding normal tissues. ELIOT may be used as the sole treatment or as a boost dose, as is more often the case, associated to conventional external beam radiotherapy, or as part and parcel of a multidisciplinary therapeutic approach. To perform intraoperative radiation therapy, it is possible to use different types of equipment, namely traditional linear accelerators, which may electron electron beams approximately ranging between 4 and 15 MeV, or linear accelerators installed in a dedicated bunker containing both the accelerator and the facilities of an operating room, or dedicated mobile linear accelerators such as Novak 7, or high-dose brachytherapy units using sources of iridium-192. In the relevant literature, there are many simple experiences showing the advantages of ELIOT in various types of cancer, in colorectal and gynecological cancer, as well as tumors of the stomach, pancreas, biliary tract, and retroperitoneal sarcomas. Several trials are testing ELIOT in lung, cervicofacial, esophageal, urogenital, bladder and prostate, brain and breast cancer. ELIOT is the ideal treatment in all those cases where a locally recurrent disease is the main cause of failure. Many clinical studies have confirmed a clear impact on local control of the disease and an increase in survival in selected cases. The problem of organizing the transport of the patient from the operating room to the radiotherapy unit, which has for a long time prevented the development of this technique and its use on a large scale, has recently been overcome by the availability on the market of small mobile accelerators, which can deliver a variable range of electron energy with a maximum limit of 10 MeV. These accelerators can be installed directly in the operating room. About 4 years ago, Novak 7, a dedicated mobile accelerator made by Hitasis in cooperation with Enea, generating electrons, was installed at the Istituto Europeo di Oncologia, based in Milan. Novak 7 was designed only for ELIOT treatments. It has special characteristics and is light and small-sized. It can be sterilized and produces low environmental radiation, and for these reasons it can be used in the operating room without any special shielded facilities for radiation protection. The possible movements that can be made with linear accelerator NOVAC 7 are the azimuth rotation around a vertical axis, shifting on the vertical plane, tilting the radiating head, rotation of the radiating head itself, and finally, it is worth noting that there are both flat and beveled applicators that make it possible to treat any kind of target satisfactorily during surgery. The most important physical characteristics for the clinical use of radiation beams generated by NOVAC 7 are the depth of penetration of the maximum percentage dose, the depth at which the absorbed dose is equal to 80% of the maximum percentage dose, which is the one that is useful from a therapeutical point of view, and then the dose rate, the intensity of the beams generated by the accelerators. Table 1 shows the various nominal beam energies, the depth of the maximum percentage dose, and the depth of the 80% dose, which is used for therapeutic purposes. For example, with a nominal energy of 7 MeV, the depth of the maximum percentage dose is 12 millimeters, while the depth of the 80% dose is 20 millimeters. This table shows the so-called dose rate of radiation used, which depends on the energy and the diameter of the applicators used. The values of the available dose rates for the 4 nominal energies are shown in this table and range between a minimum of 3.2 and a maximum of 8.5 centigrade for radiation impulse. To ensure maximum treatment effectiveness, it is not enough to know the nominal beam energy, the one declared by the company producing the equipment. It is necessary to determine it experimentally through ionization measures in water through small diodes, and through subsequent determination of the transmission curves of doses from which it is possible to calculate the actual energy of beams when they enter tissues. NOVAC 7 is a mobile linear electron accelerator specifically dedicated to intraoperative radiotherapy. Thanks to its features, it can be used directly in an operating room, as it is mounted on a facility that can be easily handled and moved within the operating room, and that can be brought close to the operating table very slowly and safely. The equipment generates different electron beam energies ranging from 3 to 9 MeV in 4 successive steps. When the equipment is beaming energy, very low energy electrons are generated around the applicators, but they can be very easily absorbed by appropriately designed mobile shielding, which makes it possible to contain radiation within the operating room.
Tale radiazione all'interno della sala operatoria.